My presentation is on cerebral palsy. What is cerebral palsy? Cerebral palsy is the most common motor disability in children. This condition affects person's ability to move, maintain balance, and posture. Even though it affects muscle movements, it is not caused by problems in the muscles and nerves. Rather, it is caused by damage or abnormalities in parts of the brain that control the muscle movements. The majority of children with cerebral palsy are born with it, even though it may not be detected until the child is at the ages of 2 to 3. It is most commonly brought to attention when a child lacks muscle coordination when trying to perform voluntary movement. Signs and symptoms of cerebral palsy. Some symptoms usually become visible when the child reaches the age of 2. For most children, cerebral palsy is diagnosed by the age of 3. Symptoms in babies and infants include low muscle tone, unable to hold up their head while in support position, muscle spasms or feeling stiff, delayed development, feeding or swallowing difficulties, favorites the use of one side of their body. Symptoms in toddlers and children are usually when they can't walk by the age of 12 to 18 months and are not speaking simple sentences by 24 months. The 5 main types of cerebral palsy. The most common type of cerebral palsy is spastic. 77% of all cases with cerebral palsy have spastic cerebral palsy. Spastic is also referred to as hypertonic CB. Most individuals will experience high muscle tone and jerky movements. This is caused when there is damage to the right side of the motor cortex in the brain. Ataxic. Only 2.4% of all cases have this. People with ataxic CB usually experience tremors and reduced muscle tone. They will have poor coordination, problems with depth perception, and speech difficulties. Athetoid, also known as dyskinetic. Only 2.6% of all cases have this. Athetoid is a combination of hypotonia, which is loosened muscles, and hypertonia, stiffened muscles, which causes muscle tone to fluctuate. Hypotonic CB. Only 2.6% of all cases are hypotonic. This is a low muscle tone that causes loss of strength and firmness, resulting in floppy muscles. Mixed cerebral palsy is only 15.4% of all cases. Mixed is when a child has more than 2 of the types listed above combined. Causes of cerebral palsy and what leads to cerebral palsy. The leading cause of cerebral palsy is an abnormal brain development or damaged developing in the brain that affects a person's ability to control their muscles. This brain abnormality, however, is not the only factor. During pregnancy and labor, doctors look for any deceleration, slow heartbeat, or fast heartbeat. When a mistake is made while monitoring heart rate by a medical professional, the child is then at a higher percentage of suffering from brain damage, seizures, and what leads to cerebral palsy. Who is most at risk? Children who are most at risk for cerebral palsy are usually born before the 37th week of pregnancy and are at an even higher risk if born before the 32nd week of pregnancy. Other children at risk are when born with a low birth weight and being part of multiple births, such as triplets or twins. It is also known to be more common in males than females. However, there is no research to support that. Medications and management for cerebral palsy. Common medications for children with cerebral palsy are anticonvulsants, which blocks or minimizes the neurologic actions that trigger seizures. Anti-inflammatories, which decreases pain. Muscle relaxants, usually treated for spasticity and helps decrease pain for muscle tightness. Benzodiazepines, used for acute seizures by binding receptor sites in the body. nerve blocks, which regulates muscle movement and motor function, and Botox, which blocks the release of acetylcholine, allowing muscles to relax and relieves muscle tone. How exercise helps and affects CB. Strength training for people with CB is the best way to increase muscular functioning by reducing muscular weaknesses. Research has proven that strength and motor function come hand in hand. By focusing exercises on the muscle groups opposite of the tight muscle groups. Eventually, the increase in strength of the weakened muscles will help balance the weakness of the tight muscles. The importance of exercise for people with cerebral palsy is to reinforce the muscle functions at a constant rate. If we continue to use our muscles, it will benefit our range of motion. My case study. An 8-year-old female was born full term with no complications, weighing 4.5 pounds. At around 6 months, the parents noticed she was unable to support the weight of her head and had a little motor control. She was only rolling on her left side and was not able to sit up or stand. She would sometimes get spasms in her legs and arms. At the age of 1.5, they took her to a clinic where she was diagnosed with spastic cerebral palsy. She was taking medications such as diazepam to relax her muscles and dantrolene to treat muscle tightness and spasms. However, the medications only made her motor functions more limited. Some exercise testing I would recommend in aerobic is to estimate my client's maximal aerobic capacity. I would conduct an adaptive cycle ergometer test. Since children with CB are known to have limited motor movement and lower levels of heart rate and oxygen uptake, I would want to make sure I don't prescribe moderate exercises. For my resistance testing, for this test, I would simply perform a neuro test with her reflexes. I would ask her as I push down on her leg to try and resist and hold her leg up. I would continue to do this for the other leg and both arms. For the flexibility, I would conduct a simple sit and reach test to determine the flexibility of my client. With her young age and condition, her muscles are known to be more floppy. This will allow me to determine her flexibility and the tension in the spine and in her legs. For my exercise prescription for aerobic, I chose the exercise of walking for 1 to 2 days per week for 30 minutes at a low intensity. For resistance, I did calf raises for 1 to 2 days per week for about 30 minutes, also at a low intensity. For flexibility, I recommend it seated hamstring stretch for 3 to 4 days per week, 15 minutes at a low intensity. Precautions and modifications. Some precautions I would take while exercising my client would be her limited motor functions, as well as her limited use for heavy objects and or machines. In addition, children with cerebral palsy tend to have a lower maximal oxygen consumption and lower values for peak anaerobic power and muscular endurance of the limbs. I would consistently make sure to spot my client in all exercises being performed due to her lack of muscle tone and strength. In addition, I would closely monitor her breathing, heart rate throughout the beginning and end of each exercise. I will keep a low pace and intensity in every exercise and focus on a slow progression. Some modifications I would make would be bi-weekly or every month. I would create a new program to make sure we target all muscle groups due to her fatigue and lack of muscle mass. Moving forward, I would continue to make sure to keep good positioning of her head and joints, since she has a past of struggling to hold the weight. In conclusion, cerebral palsy is more common in children than we think. Even though it may not be due to a birth defect, it is simply a mistake made during birth, with oxygen intake being cut off for too long, leading to brain damage and then cerebral palsy. Even though children may lose function in the limbs or have excessive spasms, exercise may be one of the best medications for this disability. Being able to continue to work on muscle tone and keeping their joints functioning will help not only keep the child healthy, but may benefit their growth for when they adult. Exercise, in my opinion, truly is a medicine for cerebral palsy. Although there may be no cure, exercise can help a child become more functional and gain a better range of motion to be able to complete everyday tasks. These are my references.